channel once more. This is another opportunity to listen to words on the health and laboratory practices. The last time we spoke, the last topic I chose was the heart. And today I am choosing something that will help the heart perfect optimally, not at low level, but at high level. The topic for discussion today is acquiring knowledge on lipid profile. Acquiring knowledge on lipid profile. This topic is very important because it helps to expose what is affecting the heart. The heart has to perform the function of supplying or transporting blood to all the cells, tissues, and organs of the body. But when there is a defect or a blockage or occlusion along the way, the efficiency of the heart is seriously affected, and you now find pains. People having pain, having stroke, having heart failure, having heart attack. So the lipid profile is one of the ways to correct this kind of problem that may arise as a result of this occlusion. What are lipid profile? Lipid profile is the summation of the following tests. Total cholesterol, 1. High density lipoprotein cholesterol, 2. Low density lipoprotein cholesterol, very low density lipoprotein cholesterol, and triglyceride. The others information you may want to gather can be finding ratios that will help in seriously diagnosing the state of the present situation of the patient's health. Health is wealth. Knowledge is power. And when you have power and wealth, you have health, life in abundance. So my effort is to create that necessary symbiotic relationship between you, the public, and the medical laboratory scientists, so that we can all enjoy life in abundance, health in the fullest, at the fullest level. The lipid profile, once it's done, is more of a test to prevent the onset of all these problems associated with the heart. Cholesterol is more or less the transporting substance of all fats. So you find that cholesterol, when the total cholesterol is over 200, then there is that deposition of fats because the body has to store it somewhere. But when it starts storing it or having it on the arteries, on the walls of the arteries, the vessels of where blood is being transported, then there is a narrowing of that artery. So it now backfires on the heart and makes the heart work extra hard. The one that is even worst of all is the coronary artery occlusion, where the heart itself, the blood supply to the heart, is then occluded, not enough. So you find that oxygen and other nutrients are not well supplied, and the heart works at very low level, not efficient at all, and gradually drifting towards heart failure, stroke, heart attack, eventually death. So to prevent all this, we need to control our diet. We have in the main a good cholesterol, which is the HDL, the high density lipoprotein, that when you have it above 40 milligrams per deciliter, it helps to really move all this cholesterol away from the vessels that would be narrowed. So you don't have that deposit of fats. You don't have fat embolism. Fat embolism happens to even create the problem of blocking blood flow, because the fat becomes the blockage, and the kind of problem the person experiences is serious. It also can now lead to myocardial infarction, which is also a serious problem. The dying of the heart cells, when the cells of the heart are dying. So the lipid profile test, apart from being used in treatment when somebody is down with heart problems, and the doctor now send the samples to the lab to evaluate all these parameters to know what to control to improve the health of the patients. Apart from that, you can use it for the prevention, which I have just emphasized. Also, the triglycerides is very useful. When you have very high level above normal, you start suspecting that person, especially if diabetes is familiar, the person is going on to come down with diabetes. So with this kind of knowledge, you'll be able to monitor your health so that you don't drift into all these chronic diseases that usually appears when one is getting older in age. You do not need to suffer pains at your old age. So even at a younger age, people are experiencing heart attack. We have seen people who die of heart attack at 40 years, 45 years. So there is that need for us to really monitor our lipid profile. Like I have said, knowledge is power. So if you like these videos of mine, then you click the like button, subscribe, and press the notification bell, so that anytime my product is out, the new production, the new videos are out, you are always notified on time. And your patronage, your subscription will encourage me to do more work. It will have better input, more quality input, so that you can have a better grip of your health. The next effort in this video is to now show you those things that you need to be aware of, because your test can be done in a lab that is not living up to expectation. The ways you can know, apart from the insignia that will let you know that this laboratory is approved by the Medical Laboratory Science Council of Nigeria, there are other things you look for, which involve the processes. There are 3 main processes in doing any laboratory test, and it's not limited to lipid profile. So I shall expose you to these three processes. They are called pre-analytical process, analytical process, and post-analytical process. The pre-analytical involves you especially, and that is where you will surely help in bringing in the best result out of your own personal preparation. The analytical involves the observation, and then post-analytical is that result that how you handle it and how it is reported, not that they are now giving you another person's result. So listen and watch to the end so that you can be more advanced. You can acquire more knowledge on lipid profile. Knowledge is power. Health is wealth. When you combine knowledge and health, then the rest are sure. So let's move on to the slide section. I've entered into the pre-analytical period where it really concerns you. The acquired knowledge on lipid profile. This is the first area that your involvement is very critical. If you want the best out of the laboratory, you must be very observant at this first stage of the laboratory test. It's very critical, and so you must be very, very observant of what is happening. So what do you take look at? You want to look at certain things that should be in place. So as we go on into the pre-analytical process, which is the first stage, you can then understand what you are supposed to do. You look at the reception and the safety. Is there any safety consideration for you? Is the place clean? Is there disposal things to where they will dispose? There is nothing on the floor that shows that even blood is allowed to stain everywhere. So these are what you want to consider, that this is a standard laboratory. The reception is the first area of your curiosity. So if the laboratory scientist wear lab coats and puts on gloves, it makes is considered about the safety of his own self and also of you that he's going to work on. The clean environment is assurance double sure of. Then the checklist on equipment is to make sure that the equipment they are using is up to standard. Every time it's being checked periodically too, so that whatever it brings out is not garbage in, garbage out, but the equipment are bringing out, churning out good results. Type of sample. In lipid profile, you are expected to collect serum sample, and that is a whole blood separated. The red blood cells are separated from the serum after it has clotted. Fasting is for 12 to 14 hours, and you must make sure that you, on your part, you know the time you have started fasting, the last meal you had overnight before going for the day. Then the time of collection should not exceed the fasting period. So you must act in collaboration. So you must not do things that. Then the standing rack is also very important, and markers that they will use to do their test. So you know they are prepared to do their test, not that they are wasting time. These are the standing rack and even the centrifuge. You can see the bottle for sample collection. That's the centrifuge. Sterile syringe and needles is one of the things that must be very, very standard, because the needle must not be used that it will not be transferring infection to you. The venipuncture must be something that is done without delay, and it must not be that they are searching for your vein for too long. They will cause hemolysis, and that affects your result. The label bottle, the name on the bottle must correspond with your own name. You must see that yes, that name on the bottle is corresponding with your own name, so that if there is an error there, that's rubbish result. Disposal of sharp, that is the needle, after and the cutting wheels and are separated. Then the separation of the analyte with the centrifuge is also a very good. That is, you look at the machines, the centrifuge they have, whether it's standard. Then the traffic flow. Is it too much or too little? That is part of what you consider in deciding how reliable their result is. This is the reception of a lab. You can even see the sharp disposal. You can see the gloves. You can see everything in perfect. So when you look at this kind of laboratory, air conditioned, you will be happy to do your test there, and the result, yes. Then we are now in the analytical part. This area does not concern you so much because you cannot see. The only thing you can see is just observe when you are seeing the equipment. There must be standard operating procedure. These are things written on the wall to follow. Standard materials, standard methodology that they have to use for the method they are using. Modern equipment is very good. When you look at the equipment and it's modern, you want to believe that the equipment is churning out very good results, because old equipment you got to recalibrate and calibrate. When you have equipment like Cobas 111 and Selectra, then you are more or less talking of clinical analytic equipment that will give you the best of the best result. These are among the latest ones. Then the environment for this, even the equipment must be air conditioned, because the equipment, when they are working in a sub environment, it's churning out wrong result. The reagent must not have expired. It must be reagent that are still within the period of allowed for usage. Qualified personnel, medical laboratory scientists in the main, you are seeing them, and then the laboratory must be assessed from outside. They must be enrolled for outside samples, which they use to check how effective their results are. Calibrated machine, yes, you calibrate your machine so that whatever it is delivering is what it is meant to deliver. This is the Selectra machine that I just talked about. You can see then, and this is the Cobas 111, very, very original. That is one of the latest. I'm sure it can do almost virtually all the chemistry analysis, giving you good results. The value for lipid profile are shown here. You can see the total. The optimal value is 200 for total cholesterol. The high, anything above 200 to 230 is considered, from 230 upward is considered very, very high. The lower density lipid profile cholesterol, you can see once it is above 150, from that is considered high. The high density lipoprotein, that's the good cholesterol. What you want is something in the region of optimal, higher than 60 milligram per deciliter. When it is lower than 40 milligram per deciliter, it is not a good result. It's something that causes that you should be very careful. The triglyceride too, can see the optimal value. Once it is higher than 130, or it should be around less than 130 as the optimal value. But once it is higher than 199, you will start feeling concerned. The post-analytical process really does not really involve much about but you can observe, like I said, the recording of result in workbook. If anybody, a medical lab scientist is working, must have a workbook that he enters the result directly. The recording of results in the register is always done by the assistant, and the entry of result in the laboratory form could come out automatically. That is, the computer can generate that result. Interpretation of result as normal, low or high is something that has to be done, because it's not everybody you give the result knows it. Then the signature of the head of the laboratory, medical lab scientist. The duration of the whole process must comply with what we call quality management. I mean, the level of quality must be rapid, in the sense that the result meets the time expected for such result to come out. Reliability, that is, the result must be reliable and it must be reproducible. That is, when you take it to other labs that are standard 5-star laboratories, the result they will churn out is almost as equally of the same value as what you have sent out. Thank you for listening. Just click the like